Thank you very much, Madam Deputy Speaker. As the Secretary of State highlights, we don't know about its severity, but Omicron mutations certainly suggest a risk of increased transmissibility and possible immune escape. However, it is expected that vaccines will still provide protection and hopefully from serious disease. So I just want to echo his call for people to get vaccinated if they haven't already done so. With S-gene dropout providing an early PCR marker for Omicron, can the Secretary of State clarify what proportion of labs in the UK assess the S-gene, and particularly if all the private labs providing travel testing are doing so, because obviously they are critical in defence of seeding cases into the UK? I welcome the logical reintroduction of a pre-travel PCR, but does he recognise that still the average incubation of COVID is 5 days, and does he not agree with the call from the Scottish and Welsh governments to have a day 8 test for release? Will the government now hold a four-nation COBRA meeting to discuss the response, and will the government also commit to providing support for the travel sector and any other businesses that might be impacted by public restrictions going forward? The Secretary of State described it as a global battle, and he's right, but the establishment of Omicron in the UK is a stark reminder of the failure of wealthy nations to take a global response, as they promised last spring. While almost 90% of adults in the UK are doubly vaccinated, less than 4% in low-income countries have even had one dose, and less than a quarter of their healthcare staff are protected. The UK government promised to deliver 100 million doses by next summer, but has so far delivered less than 10 million, and shamefully destroyed 600,000 doses in August. It's estimated the UK will be left with almost 100 million excess doses. So will this government not accelerate their donations to COVAX? And finally, Madam Deputy Speaker, 130 countries support the principle of waiving intellectual property rights and technological transfer to mount a global response to this pandemic. So why is the UK government blocking the TRIPS waiver when most of these vaccines were developed with millions of pounds of public money?
Secretary of State.
Thank you, Madam Deputy Speaker. First of all, can I thank the Honourable Lady for her support for vaccination in general, right across the UK. It's really making a difference, and I thank her for her comments on that and the importance especially of the booster programme. In terms of testing for this variant, she talked about the proxy measure, which is the S-gene dropout, but there are other methods that UCS have also started deploying alongside that, which stop short of sequencing, which does take much longer, and there's not universal capability of that. And between these two proxy methods, the majority of testing centres can pick up the potential marker for Omicron, but we are expanding that as well, so that all testing centres will be able to do it very soon. In terms of the Honourable Lady talked about the restrictions, I would just point to one of the important points I made earlier about the restrictions are temporary. As soon as they can be removed, we will, and I think that's what industry and others would want to see, that as soon as we don't need them, we can remove them without any delay. And in terms of vaccine donations, I think the UK can be proud of its commitment to vaccine donations to the developing world. We've got a commitment of 100 million by June 2022. We've already delivered 22 million to COVAX, and bilaterally there's another 9 million on its way in the next couple of weeks, and we will meet our commitment.